Hello, everybody. Welcome to Rev Up Health podcast today. And so today we're going to kind of go about this a little bit differently. We're going to look up the women's hormone journey, but more from a personalized perspective, specifically Tandi's story. So, it's something that I think there's a lot of women out there that struggle with, hormone shifts and kind of trying to understand maybe why they feel like this and what can be done and what they've gone through. And so we just kind of want to get a little more personal from this perspective and kind of just let everyone know that yes, you have troubles and you have problems, and Tandi did too, and she's going to open her heart and tell us all about the details of that. But we really just need to understand that 80% of the women, over 80%, I think, women will go through some type of hormone imbalance, and it's pretty significant, and it can be a variety of different things. But we'll just kind of go from Tandi's perspective and kind of talk about this.
Yeah, want to just also recognize that this is just my story. And as we talk all the time, each person is unique and individual. So there may be some things that are similar and that can be related to, but certainly my story is not going to be applicable to everyone.
Yeah. I mean, we talk about hormones and life balance, if you will, a lot in our clinic, and but it's certainly something that to hear from a personal perspective from someone that's actually gone through it and talks to other individuals is kind of comforting to kind of know that you're not alone. So, but tell us, Tandi, what what do you want people to understand about this? Women to understand.
Well, I think you've hit the nail on the head by just hearing another person's perspective. And I will say that as a young person, there wasn't a lot of talk like there is today to know what to expect from the onset of cycles through menopause. There really wasn't even a lot of conversation in my household with my mom. And, it was just pretty much figuring it out
Right.
on your own. And the truth is, my cycle history was not similar to my mom's either. So
True. Yeah.
there's that too.
Yeah, it's not like it's a dinner topic, that everybody brings this up at family meetings and family dinners. So
Right.
it's certainly something that a lot of women struggle with, though.
And it is something that you hear now, that your menstrual cycle is like another vital sign. And it really is. It tells a story for sure. And I would say that a big part of my story around hormones and hormone replacement is around depression that I struggled with, probably starting at the age of 16, maybe a little bit even before that, but really started struggling at the age of 16. And that went on really my entire adult life.
What were your cycles like growing up?
During that time, honestly, I didn't pay a lot of attention. I feel like they were pretty regular. I had a lot of PMS symptoms around bloating, gas, mood changes, the whole laundry list.
Fatigue, I'm sure.
Yeah. I mean, my cycles hit me pretty hard. And that's kind of where I understand my mom and I differed in our experience in cycles. And, you just really, there wasn't a lot of talk about it.
Right. And there's a lot of, there's signs and symptoms are aplenty. There's well over 70 plus different signs and symptoms of hormone changes and, deficiencies or perimenopause to menopause. But, what were some of your big signs that you had? You had some troubles with fatigue or sleep?
So when I first headed down the hormone replacement path, I was feeling fatigued. I was having trouble sleeping. I was talking with a nutritionist to kind of find out, what am I doing wrong? What am I getting wrong here? And I actually started down the path more on thyroid than than the sex hormone replacement.
Do you feel like that some of your thyroid discussion that you found out, do you feel like that was something that maybe got ignored by primary care physicians? Or
Oh, I definitely know. I asked my primary care on more than one occasion to check my thyroid.
because you felt fatigued,
Fatigue, weight gain.
difficult
Fatigue was
sleeping?
probably the biggest thing that caused me to ask. Fatigue and weight gain were the two things that had prompted me to ask my care providers at the time. It was definitely more than one occasion I requested to know what my thyroid was. And at the time, I don't know that I know for sure, but I'm pretty certain that all they were looking at was my TSH.
Right.
And I honestly didn't even think to talk about mood.
Mood or depression?
Mood or depression, it didn't even occur to me that that could be a hormonal thing.
Right.
I mean, you talk about or you hear about it being a chemical thing, but you don't necessarily hear about. I never put that together
Yeah.
before. So
I mean, it seems like that, unfortunately, a lot of women, when they go in to speak to their healthcare provider, and unfortunately they're offered an antidepressant or some other SSRIs to try to control their mood and temperament. But it's certainly it's something that's so obvious when you see it from the other side of the fence.
yeah, so the other thing I will mention before we kind of move on to when I started hormone replacement therapy is I had terrible postpartum depression after my first daughter was born. It was a very, very dark time for me. And it was almost like we didn't talk about it. And when I say we, I mean my family, me. It was just, we lived it. And then
Just
when we got,
part of life, right?
yeah,
You have children, and you go through, some women go through depression, some women don't. You deal with it and you move on.
yeah. I mean, we didn't talk about it until I had made it through it. And then we were like, holy cow, that was crazy. So that was kind of my first big experience of a hormonal, which even then, I don't know that I put the hormonal piece together, but not long after I got over that, I got pregnant again. And so then immediately after my second daughter was born, I was put on antidepressants to help with the, to not go through that same part of depression. Yeah, in the hospital.
Yeah, wow.
It was prescribed. And that
Progesterone level probably wasn't even down enough yet. You already started on it.
But I will say that I didn't have the problem with the postpartum depression. So that, that did help. And I didn't, I was on that antidepressant for a little while and then was able to wean myself off of it and go along with raising two kids. And then we'll come to the point where I did reach out.
Yeah. So you started basically your hormone journey kind of initiated from seeing a nutritionist, you mentioned.
Yes. So I was talking with a nutritionist and she looked at a functional nutritionist and she looked at my lab values and noticed that my thyroid was on the low end of normal.
But still normal.
It was normal. Yes, it was normal. And I remember asking if you would consider
your favorite ear, nose, and throat doctor,
right? If you would be willing to talk about thyroid replacement.
And me and my traditional Western medicine teaching and understanding and belief before was taught to me, if your TSH is normal and your other thyroid hormone levels are in the normal range, then it's not your thyroid.
Yes. So, but you were open to me exploring other avenues. And that's when I found Dr. Ann Morgan and we started down that path. And so when I first started hormone replacement therapy, I was about 40 years old. I was fatigued, still struggling with depression, having a hard time sleeping. I remember at the time we had a dog who would wake up a lot during the night and roam around the house. And during this time, he would wake me up. I was not sleeping well. And so as soon as he would wake up, I would wake up, and then it would be a struggle to get back to sleep. And I would lay in bed for, an hour.
Listen to everybody sleep. Yes.
Yes, it was terrible. And so that's kind of what was going on at that time. And I started my journey with thyroid replacement, progesterone, and testosterone.
Mm-hmm. Yeah. Progesterone, testosterone, in addition to thyroid, those are some real life-saving medications.
And it really was life-changing for me. And it wasn't instant. The sleep came pretty quick. Like, I was then sleeping better, which was fantastic. And the thyroid helped with, they all work together. But to me, the thyroid really helped with energy and also with the depression, which is something that we've learned a lot more as we've studied.
Yeah, because it's not just a low number that we're treating. I mean, we're treating symptoms, signs and symptoms of thyroid deficiency. And there's a big difference there. We talk about that in other podcasts about our thyroid and how we treat that. But, there can be issues with receptors and cellular activities that create the problems that gives us the signs and symptoms of a low deficient thyroid function. And that makes a difference, I think, to treat the patient like that. And then we move on from midlife, perimenopause times to approaching the menopause scene.
Yeah.
So how did those signs and symptoms change or develop?
So I would say for the first, 5 to 6 years, it was pretty smooth sailing once I got started. I was sleeping well. My energy was better. Workouts are better. I really didn't have a ton of symptoms during that time. I was feeling better than I had probably in my entire life, because the depression wasn't as much of a struggle. Not that it's non-existent, but
and the irregularities in the cycles and the irregularities in mood and the variances. So
yeah. And, cycles were very light. And then I would say within the past year, I started having what seemed more like regular cycles again, which was different, but it wasn't anything that was unbearable or intolerable. It was. And then during that year, noticed itchy ears is one of my big symptoms. Vaginal dryness, irritability was a little bit more present. And so I did labs in June, and all my numbers looked like I was still in perimenopause.
Yeah.
But just kind of continued to have these kind of feelings of a little bit more irritable, lots of dryness, but still no hot sweats, no mood changes that were like what I had experienced in the past.
But you were on replacement. You were already on replacement hormone therapy. In other words, it's progesterone, testosterone, as well as thyroid.
Yes, correct.
And so when the estrogen levels began to drop, the FSH levels began to raise. Now we're looking at, maybe there's a menopause factor that we need to consider.
So we did labs again in October, and sure enough, estradiol is 10, FSH is 76, and now I've gone 60 some days now without having a cycle.
Right. So, and you also had some just one thing that I think that a lot of women let's just put it this way, every woman will experience it. I mean, if a woman lives long enough, they're going to experience menopause symptoms, period.
Yes.
Now, to kind of clarify, it's like the biggest symptom, I think, one of the biggest ones I think that a lot of women that we see experience or talk about is just the feeling of not being on, feeling off.
Yes, I felt that. that
No.
apathy kind of,
It's like, why do I feel like this? What's the matter?
yeah.
Why do I react this way?
You,
Types of
you,
things.
and it's not, you really can't pinpoint what it is. But
Something's not right.
I knew for probably at least the last 6 months that I just was feeling off.
Mm-hmm. You had one of the classic signs of perimenopause and menopause is frozen shoulder,
I did. Yes.
and underwent physical therapy for that. Did well. I mean,
Mhm.
you did. That's obviously it worked great for that. But that's certainly something that affects a lot of women too. That's like, why do I have a frozen shoulder? Well, hormonal imbalance
Yeah.
is a factor of that.
I would say that that is another thing I'm kind of remembering as we're talking through this. But I would say over the last year, maybe even a little bit longer than a year, joint pain, more joint pain, joint stiffness has been present.
Yeah, yeah. Just aches and pains, whether it be back, knees, feet, whatever.
Yeah.
So, but these types of things are. We mentioned that HRT was kind of a life-changing thing for you.
Yeah, it was. And I would say, as the person who lives with me, what was your experience of the transition on hormone replacement therapy? I mean,
Yeah, that's certainly. I got to be careful. I don't want to get myself in trouble. But yes, I definitely notice a difference. Before pre-hormone replacement therapy and post-hormone replacement therapy, from mood swings and irritability, and there are just certain times of the month that I just have to be careful and be supportive. And that's the best way I can say it. You just have to be careful and be supportive, because you know that yes, men will also go through these things, but not really to the extent that women do. And it is total difference. I tell this to women all the time. Women are so much more complicated than men. Our transition is so much slower. Women transition is so much faster and more abrupt. And women, I think, seem to pay a lot of attention to how those things go.
yes, we do.
I think
And I think
men are
that,
just a little more stoic.
yes, I would agree with that too. And I would say that certainly you have had also symptoms
Yeah.
of andropause. And there are times when I know, as somebody who worked in an office full of women, where we would joke about menopause and,
Yep.
when there were things like that happening. But I do think that it is something to be said that your open-mindedness to kind of watch me go down this path and then decide to do your own education around it says something.
That is a huge thing. And I can say that from a male husband perspective, but also as a healthcare provider perspective, that if we, no matter what hat you wear, if we don't be more sensitive to the fact that you don't know everything, and that you have to continually update your way of thinking.
And when you say you mean I and everyone. It's the
I'm
universal
talking about
canon.
myself. I am being more personal here too. You are being personal, so am I. But you have to update your way of thinking, both from a healthcare perspective, but also just as from a a spouse perspective too. That things change, and your old way of thinking may have been a cognitive dissonance attitude, that this is the way I used to, this is the way I've been taught, this is the way it is, and this is the way it's always going to be. And that is farthest from the truth. And because I can tell you right now that half of all the stuff we know in 5 years is going to change again. So that technology and the studies and the information is out there. But it's certainly something that I am glad that I had more of an open mind about these types of feelings and hormone changes that actually happen. So, but what experience with your hormone replacement therapy, what really has surprised you the most? What really surprised you the most?
So, two things about taking hormone replacement therapy and learning more about hormone replacement therapy. it was life-changing. I've said that already, but starting thyroid replacement therapy, and this is my experience has been that I believe my depression was related to a poor functioning thyroid
And progesterone.
And that's another piece that I never knew until I started going through, continuing my education around hormone replacement therapy, that is the actual cause of postpartum depression.
Right.
When your progesterone is in the 200s while you're pregnant, and then you deliver and your progesterone tanks.
Right.
And that is why
Instantly
women suffer from postpartum depression. And so I think that those were the two biggest surprising things for me personally, is learning later in life that, this is part of the chemistry and hormone imbalance that I was struggling with.
And some of the things that I've learned the most about this too is the fact that normal is not optimal.
Sure.
I mean, optimal is a total different ballgame. I mean, our hormone levels continue to fade and change and decline as we age, and midlife is when it starts. That's when things start to feel off. And then, as we progress, it just continues to decline. So that's kind of the nice thing, that, we don't have to feel this way. You don't have to feel fatigued. You don't have to feel cold, tired, and fatigued. So
Sure.
it's nice to know that. But so as we're going through this current phase now, do you see this as a new beginning or an end?
Definitely not an end. We talk about that all the time. I think that this time of life is so empowering because we have an opportunity to listen closer to our bodies and use this information to make adjustments and get to a place where we're feeling good and, really get to optimal health, where you can do the things that you want to do in the manner that you want to do them, hopefully for as long as you live.
Right. And, there's a lot of misconceptions about hormone replacement therapy, but the hormone replacement therapy we're speaking of is more bioidentical hormone replacement therapy. It is not synthetic. And I think that's where, with the old WHI trial back in 2000, that's when those misconceptions really became a wildfire. And women then went from 1 in 4 utilizing hormone replacement therapy to 1 in 25. I mean, it's just instantly happened also.
Yeah. I actually remember talking to my GYN about that study. I mean, it was all over the news and saying, asking about birth control and is that okay? And truthfully, I was not on birth control a whole lot of my adult life. Some women start, really young and are on it for almost their entire adult life. And I was not, honestly, because I had some pretty terrible side effects to birth control, different types of birth control and all of that. But
right. And those are synthetic forms of birth control.
yeah.
But correct. So, all right. Well.
Oh, and I guess, spoiler alert, even though I don't technically meet the criteria for a clinical definition of menopausal, because the clinical definition of menopause includes 365 days of no cycle. And however, I have little to no estradiol, and my FSH is 76. So
signs and symptoms. So why do you want to suffer for a whole year? That's kind of where I get to. Yeah. It's like, why do you want to wait around for a year for that type of, those symptoms to just continue to linger?
Yeah. So I have started estradiol replacement at this point.
Yeah. The benefits of the brain, bone, and heart, vascular benefits, and breast and cancer protection. It's just incredible that hormone replacement provides. And so I think that's one thing that really needs to be emphasized too.
Yeah. And this is really like I said at the beginning, this is my experience and my story, and there are lots of other experiences and stories out there. And, you know, sometimes people don't tolerate certain
Right.
replacements. And so then you have to get creative and look for other options and, tweak things. And
Yeah, there's a lot of pages to the book of life. So
yeah,
we all have a different page and then we all look differently about that. But for women that are going through perimenopause or into menopause now, it's never too late to initiate hormone replacement therapy. I don't care what anyone tells you, that studies suggest that it is safe, and that there's a lot of benefits to it at any age. But what would you say to the women that are going through perimenopause and or in menopause currently and are having these symptoms and these feelings and just feeling that something's off? What would you suggest to them?
well, I think the biggest thing is advocate for yourself. And I think I say that because that's what I would tell my younger self. It's okay to make a little noise, and it's okay to not be okay, and ask for help.
And women
And
just don't need to suffer in silence.
yeah, and letting people know where you're at and what you need and what you're after is, so helpful. And advocate, whether it's with your provider or with your family, with
Yeah. And men, if you think that you're the only ones going through perimenopause and menopause, you're not, because you are too. So you need to support the female in your family. So, well, Tandy, I really appreciate you being a little pretty honest today about this, and it's kind of a difficult thing to talk about. Sometimes you don't like to explain too much of your privacy, but certainly I appreciate you opening up on that.
it was a pleasure. And, obviously happy to help anytime, but just want to reiterate again that midlife is not the end of vitality. It is the beginning of intentional living. And it's
That's true story. It's certainly something that you don't need to go it alone. But we hope that everyone gained a little bit of insight out of our discussion today, and stay tuned for more.
all right. Have a healthy day.